Prolonged isolation with a lack of clarity is taking a toll on the mental health of migrant workers here. That's according to workers and aid groups we spoke with, who say it's exacerbating anxiety among workers who are already worried about income and employment amid the pandemic. Isabel Lim with more.
Abdul Kader used to stay at a dormitory in McPherson, but at the end of April he was moved to a hotel in Novena, where he says he remained in quarantine for 3 months, despite testing negative for COVID-19 twice.
It's very frustrated if you are in jail and you don't know why you are in jail. That makes the thing much worse. And don't know why you are in quarantine and how long you have to stay in quarantine, when you can go back to the dormitory, when you can go back to the work.
Abdul managed to get through the quarantine by taking online classes and staying connected with friends and family. But some workers may not be faring as well. Charity Health Serve says it saw a rise in anxiety cases among workers who had to stay in isolation facilities for prolonged periods of time.
When they were some negative, that was where there was a bit of a gray area of what do we do with them. And then in turn, that led to a lot of them being left in these isolation facilities for a prolonged period of time. Because some of these facilities, they weren't allowed to even crack open the window just to have a breath of fresh air. They couldn't open the doors or step out of the doors.
And it's not just the feeling of being left alone that's weighing on their mental health.
The stress and anxiety, of course, is due to loss of income, due to the financial burdens on their families. Another thing with the long period of time of the lockdown is also that the anxiety caused by the lack of clarity, the lack of information about what is going to happen to me next. When can I get back to work?
Over the past 2 weeks, the police have responded to a string of incidents in dormitories where workers who were apprehended appear to have attempted suicide. Health Serve says it has seen a tripling of cases of suicidal ideation among its clients in the same period. It has counselled over 700 workers since April. Another group, the Migrant Workers Centre, provides assistance through its helpline. Its network of 5,000 worker ambassadors also ring their countrymen to provide emotional support to workers, including those in isolation facilities. The Manpower Ministry advises workers not to put themselves in harm's way should they encounter problems. With dormitories due to be cleared in the coming days, more workers may be going back to familiar environments. But they say what could really make a difference is returning to work.
I think everybody wants to go back to their work. If you are alone, people think too much about their past and so many stuff going on in your head. But if you are in work, you actually forget these kind of things and move you forward.